Almost 2 million people will visit the doctor in the US this year because of a rotator cuff injury, and it might be surprising to hear, but less than 25% of them may require surgery at all. And that's good news to hear because non-surgical rotator cuff treatments like physical therapy can really help decrease pain and improve function of your shoulder with up to a 75% success rate according to some research. As a physical therapist myself, I've worked with a lot of people who have had partial to full thickness rotator cuff tears, and even after a few weeks of physical therapy, their strength and their function had improved significantly. Today we're going to go over the top 10 exercises I share in the clinic to help people who are having pain in their shoulder because of a rotator cuff injury. Let's get started. And of course, always check in with your own PT or your surgeon before doing any of these exercises or movements. These are part of my non-surgical rotator cuff rehab program, and if you're recovering from an actual surgery, you need to follow the timeline and the protocols set by your surgeon and your physical therapist. The first exercise is called the Pendulum Exercise. With your feet about shoulder width apart, hold on to a chair or a countertop and lean over to allow that painful arm to hang. Keep your arm as relaxed as possible and shift your body to cause your arm to swing like a pendulum back and forth or even in a circular motion. This is a great way to relieve pressure in the shoulder joint as the hanging provides a slight distraction of the shoulder joint, which can be increased by holding a small weight. Performing this throughout the day can be a really helpful way to relieve pain, and it only takes a few seconds, so try to perform this motion for 20 to 30 seconds at a time, multiple times a day. This second exercise is called scapular retraction, or simply shoulder squeezes. This is a great exercise for posture and is really important for activating the muscles that support the shoulder and the rotator cuff. Now, the key to this exercise is to keep your neck relaxed and to squeeze your shoulder blades together, holding for about 1 to 2 seconds, and repeat this movement 15 to 20 times. It's the perfect exercise to do every couple of hours, especially if you work behind a computer or you find yourself sitting for a long period of time. Okay, on to the third exercise, isometric holds. There are 4 variations of this exercise, all targeting a different direction of the shoulder. The first isometric hold is in the direction of shoulder flexion. Place your arm at your side with your elbow at 90 degrees. Now make a fist and softly press into a towel at the wall. Hold this for 3 to 4 seconds and relax, performing 10 repetitions before moving on to the opposite movement of shoulder extension. For this variation, you'll place the towel between your elbow and the wall. Your goal here is to gently press into the towel with your elbow, which should not be painful at all. If any of these isometric holds increase pain, then back off the intensity or just skip it completely until you can perform it without any pain. The third and fourth variations of the isometric hold will focus on rotational movements. So take the towel and place it between the back of your hand and the wall. This may be a painful movement initially, so just ease into that pressing movement gradually, holding for 3 to 4 seconds, and repeat 10 to 15 times. To perform the fourth isometric movement, you'll need to position the towel between your palm and the doorway as you apply force that rotates inward, or internal rotation. Follow the same cues and hold for 3 to 4 seconds, then repeat 10 times without any pain. Okay, the first 3 exercises are great for early recovery and pain reduction, and the next few will focus on improving range of motion and stability. So let me know if you're finding this to be helpful so far by giving this video a like below, and be sure to comment with any questions you have on these exercises. For this exercise, you'll need a flat surface and a stick or a cane. This is called assisted shoulder flexion, and while it may seem very basic, these movements are really important because we want to make sure you have as much pain-free range of motion as possible before we emphasize other strengthening exercises. Start with both arms extended at your knees. Now bring your arms into full flexion, but stop at the point where you start to feel any discomfort in the shoulder. Then bring your arms back down and continue the movement progression 10 to 12 times. You'll start to notice that you can go further and further each time as you do this exercise 2 to 3 times a day, and it should become a lot easier, especially if your injury is pretty recent. You can also try using the stick to bring your arm out into abduction or out to the side. This is usually a little bit more uncomfortable initially, so use a pillow under your arm for support and ease into that movement of abduction. This fifth exercise is called a table slide, and I usually start with a table slide because it helps to work through this painful motion of reaching forward. At a kitchen table or a countertop, glide your arm in front of you, sliding it along the table in a pain-free range. Gradually increase your range and perform 10 to 15 repetitions 2 to 3 times a day. If this becomes too easy, you can swap out the table slide for the wall slide and perform this movement in a pain-free range in substitution. try to keep your neck relaxed with this movement and only go as far as you can up the wall without any pain. Make sure to keep your arms relaxed as you slide your arms back down and repeat this movement 10 to 15 times. Okay, number 6 is called weight shifting, and I like this movement because it promotes stability in the shoulder and it's easy to perform anywhere you have a countertop. Just place your hands shoulder width apart and shift your weight towards one arm and back to the more stable arm, alternating between arms every 3 to 5 seconds. Do this for about a minute and take a break, mixing it into your day when you're in the kitchen or your bathroom or anywhere you have a countertop or a desk. Exercise 7 starts the more difficult movements as we begin to introduce some resistance, like this side-lying external rotation exercise. This exercise really targets 3 of the 4 rotator cuff muscles as we perform this movement called external rotation, and it can be really difficult or even painful to perform. So if you have a rotator cuff tear, we just want to be really careful to perform this movement in a pain-free range as much as possible. Before you start, place a rolled up towel under your elbow between your arm and your body. This will help to avoid strain to your shoulder and really isolate the muscles we need to strengthen. Gently rotate your arm so your hand moves up towards the ceiling while keeping your upper arm flat against the towel. Just be careful not to lift your arm like a chicken wing as you move through this motion. You don't actually need any weight for this exercise to begin, but after a few days you may start to be able to progress to a half pound or even 1 to 2 pounds as you're able to. Aim to do 2 to 3 sets of 10 repetitions of this exercise, and of course stop if you're having any pain in your shoulder and work on the other pain-free exercises on this list. Exercise number 8 is the resisted row, and for the row exercise we'll be using some resistance bands, which I'll link to in the description below. Now the idea with a resisted row is to keep your neck relaxed and to perform the scapular squeeze as you bring your arms towards your body. This movement should not be painful, but it may get a little tiring as you perform 2 to 3 sets of 10 rows with resistance bands. You really don't need much resistance to engage the muscles of your shoulder, so I like to start with red or yellow, then work up to the green or the blue band. Okay, number 9 is resisted shoulder rotation. The first way we can perform this movement is with both arms, keeping your elbows at your side while stretching the band apart. It's helpful here to squeeze your shoulder blades before you initiate the rotation with your arms because it helps to stabilize your shoulders. You can also loop the band around a sturdy pole, or if you have the door loop that comes with resistance bands like I'm using, you can use it to slide into the door and to perform this unilateral movement. I like isolating the rotator cuff this way because I can target both external rotation and internal rotation just by turning around and using the band to provide resistance as I bring my arm towards my body or away from my body. Like most of the strengthening exercises here, you can try to perform 2 to 3 sets of 10 to 12 repetitions as long as the movements are pain-free, and then gradually increase the resistance as you're able to. Number 10 is definitely one of the more advanced movements that I perform with my patients when they've demonstrated a few weeks of improvements with their motion and their strength. I call this exercise the diagonal band exercise, and it works like this. Start by initiating a small shoulder squeeze and stretch the band in a diagonal pattern. Return to the starting position and repeat the movement in the opposite direction as you continue to focus on setting your shoulders with that small squeeze of your shoulder blades. Okay, so there you have it, 10 exercise ideas that I commonly perform with my patients for non-operative rotator cuff rehab. Remember, these are all sample exercises, so don't think that you need to work through each and every one of these right out the gate. Your physical therapist may assign a few of these to start and then progress with some additional movements as you can perform them in a pain-free range of motion. I find that people really do well when they perform just a few of these exercises, even just 2 to 3 times a day. And if you're interested in any of the tools that I've used in this video, you can check them out in the description below. Hey, if you found this video to be helpful, I would love it if you gave it a like below, and also be sure to subscribe to the channel for more helpful videos like this and this one right here. Thanks for watching. I'll see you in the next video.